What's going on? It's Dr. Chris here. Today, I want to go into an ortho episode talking about the shoulder and specifically what limits shoulder range of motion. Now, it's hard to talk about range of motion and shoulder and not talk about pain because I do live in Southwest Florida and it's all tennis, golf, and pickleball here. And we have an aging population here, so it's common to run into a lot of shoulder issues down here. So the majority of shoulder pain is either that you've exceeded the tissue's capacity for what you're asking it to do, or you've moved it past its physiologic barrier. That's just from the mechanical and sort of orthopedic aspect. But pain is super complicated, and it has a lot to do with the rest of your life, all the lifestyle triggers, sleep, hydration, movement, nutrition, all those things play a role. And I mention this because one of the things that can limit your shoulder range of motion is a frozen shoulder, adhesive capsulitis. And there's a lot of, what I learned in school was we don't fully understand it, that it has a lot to do with hormones, diabetes, smoking. There's always like underlying risk factors to develop it. And I've come across a lot of emerging evidence that suggests that it could be an autoimmune condition, which goes to a lot into the diet. For example, if you are vitamin D deficient, that vitamin D is a modulator of the immune system. So if you're deficient, your immune system kind of goes out of whack and starts to attack tissues. And one of the tissues it can attack is the capsule of the shoulder. And so that could be due to some gut issues. So you can kind of like everything starts in the gut. So that is one of the limiters of range of motion. Just so bear that in mind. I just want to kind of get that out of the way because I want to get more into orthopedic stuff. So I'll start off with muscle. So basically, the main categories of things that can limit the range of motion would be muscle, skeleton, right? So bones, nerves, and the capsule. So I address the capsule a bit. With the muscles, this is going to be the biggest part of this whole podcast. I'll start off with flexion. What muscles are going to limit flexion? So in general, what a muscle does, it limits the opposite. So a bicep can bend the elbow or elbow flexion, so it'll limit extension. That's a general rule of thumb, because you'll see that doesn't always play out that way, very textbook style. So with flexion, so reaching overhead like you're raising your hand in class, right? Flexion. The muscles that tend to limit that, the biggest one by far would be the lat. The lat is a shoulder extender. It's common to get stiff in those lats. Another muscle that can tend to limit it would be the pec, for a number of reasons, but the pec kind of does like a flapping the wing kind of movement. So it's an adduction of the humerus. So if that is particularly stiff, that can limit overhead range of motion as well. With external rotation, so that is, think of what a pitcher's arm is doing when he's cocked back, right? That's external rotation. So the internal rotators of the shoulder tend to limit that range of motion. So the big ones are, you're going to see a lot of common patterns here. The big internal rotators of the shoulder are the pec, the lat, and another one that's actually one of the four rotator cuff muscles is your subscapularis. That's a pretty strong internal rotator too. It tends, in my opinion, it tends to be more pec and lat oriented. There are certain sports that will set you up to be really stiff and strong in the subscapularis, particularly swimming. Right? So if you've seen a swimmer's back, you'll see they have those wide shoulders. Really what you're seeing, that subscapularis sits underneath the scapula and attaches to the humerus. So it gets stiff enough to a point where it actually draws the scapula kind of wide. All right, so if you have that pattern, that tends to make your arm sit into internal rotation and will limit the opposite, which would be external rotation. Okay, so what limits internal rotation? Well, this one, I don't spend a whole lot of time improving someone's internal rotation unless they can't like reach behind their back at all. That's kind of what that muscle is. Think of it like a scarecrow, the arms, elbows out, and then arms down. That's internal rotation of the shoulder. So functionally speaking, it just depends on what you need to do. I don't love like kind of torquing the joint into internal rotation, because theoretically the things that limit internal rotation will be the external rotators. So in this case, it'd be 3 out of the 4 rotator cuff muscles. So sort of the classic move to improve internal rotation is like the sleeper stretch, And again, I don't love the idea of just taking the rotator cuff and twisting it. These are small muscles. I don't know. I've seen shoulders get a little tweaky if you're doing too much stretching like that. You could do sort of what people would think of as like a tricep stretch, where you grab your elbow and pull across your body. That theoretically can stretch the rotator cuff in a more pleasant way. So that may be one way to stretch for improvement of internal rotation. Now, extension, this one's interesting. So extension is reaching your arm straight back behind you. So the pec can definitely limit that, because the pec tends to bring the arm out in front of you a little more. But more often than not, I find that the lat, which is a shoulder extensor, can actually limit extension. Why? It's kind of like soft tissue approximation. The fibers are kind of crowding themselves. So think of somebody who had like a really big bicep. Although the bicep does elbow flexion, if it's so big that the tissue kind of rams into itself, it's sort of an insufficiency, then you can't really touch your mouth, right? That's like basically the same concept with the lats. This only happens with like really big guys typically. If their lat is super stiff, then it's hard for them to reach behind their back. And all you have to do to kind of prove this to yourself is do like 5 sets of pull-ups to failure. And when that lat stiffens up and it fills up with blood from doing that, it'll be hard to reach behind your back. What else? Those are probably the biggest ones I would see when it comes to the muscular system. So for the majority of people, it's going to be pec and lat. But pec and the lat are what I usually go after to get range of motion back. So massage helps, stretching helps. I like to do a lot of like quote unquote soft tissue release, which means like kind of putting a ball right on the pec and, you know, getting some movements. Same thing, you can get a ball and kind of, or a foam roller and roll on the lat. That's going to help with some mobility. Now, when it comes to the musculoskeletal system, particularly the skeletal system, there's a couple things here, a couple of relationships I want to talk about that can limit range of motion. So this kind of goes into pain a little bit too. So the supraspinatus is one of the rotator cuff muscles. It sits underneath the AC joint. That's where your collarbone and your scapula meet. When you go into overhead motion, if you go to the end range, that supraspinatus sort of theoretically runs into that AC joint and can feel kind of sharp and pinchy. So there's a couple things here. So the scapula can kind of tip forward, so anterior tipping, and it can tip backwards, or there's posterior tipping. The muscle that controls, the main muscle that controls anterior tipping of the shoulder blade is the pec minor, so right in the front of the chest here. And then the one that controls posterior tipping is your lower trap. So if there's any kind of imbalance there where the pec minor is way stiffer and the lower trap may be weak, which is a very common pattern to see, then the shoulder blades will tend to sit into this anterior tipped position. And that just means that the AC joint sits a little forward. So you're able to run into that AC joint kind of sooner in your range of motion, and that will limit your flexion. And a similar thing happens with the thoracic spine, so your upper spine. And we see this pattern all the time because most people have to sit for work, so they tend to get kind of stuck in a little bit of flexion or kind of rounded at the upper back. So you can kind of, and that changes the position of the shoulder blade. It basically creates a type of anterior tipping as well. So you can kind of test this out. If you kind of sit down and slouch, round your upper back, raise your arm overhead into flexion as much as you can, you'll notice that, you know, there's a point where it starts to not feel so hot. Then sit up straight and then see how high you can go. You usually get in there 20 to 30 degrees. So that's another common area that we attack is the thoracic spine. And we try to go into extension to get some more mobility back for flexion of the shoulder. So the other thing too with the capsule, besides the frozen shoulder, the adhesive capsule, that can get stiff typically on the back and bottom side. And that's going to change the dynamics of the shoulder, particularly into abduction, which is lifting your arm out into the side. So there's certain capsular mobilizations that we can do. I'm not going to dive too deep into that because it gets really complicated and that goes into joint mechanics. But just know that it is a possibility. And the capsule, we describe the capsule a lot as like a leathery sac around the shoulder. It's not, it's actually, it's a little more complicated than that. It's not its own unique structure. It's actually sort of an amalgamation of the tissues in that area. So it's really the ligaments that attach bone to bone in that area of the shoulder, and some of the fascia and some of the tendons, the muscle, they all kind of come together and create this sort of quote unquote capsule. And sort of the last thing that I would mention that can potentially limit the shoulder would be the nervous system. Not as common, and there's particularly one position, sort of the front rack position, that can limit that motion, would be your ulnar nerve. So your nervous system is all like one set of tubes. It's really your brain, your spinal cord, and all the peripheral nerves, all one set of cables in a sense. And when you move your head in one direction, those cables have to slide in the towards the same way you're rotating your head. So in other words, if your arm is out to the side, and then you look to your, say your left arm's out your side, and you look to your right, all the nerves kind of drag towards the right. If you turn your head back to center, and then you move your wrist into extension, the nerves go in that direction. They have to slide a few millimeters. And if they get snagged anywhere in the pathway, which is very possible, and actually that's pretty common, then it'll give you sort of a nervy type pain. It's not going to feel so good. So with the shoulder in particular, the main one I see is that front rack position, which is the arms out in front and your wrist into extension, like you're about to do a front squat. The ulnar nerve kind of maximally gets traction in that position, and that can get kind of snagged and not feel so hot. So there you have it. Those are the most common things I see. If you're not so sure, the easiest thing to do is just to go right after a pec, lat, and some thoracic extension. That's usually going to buy you a fair amount of range of motion back. If you have questions about this, feel free to reach out, Chris at dynamicnaples.com, and I'll be talking to you guys soon.